G'day everyone, Tom Kenneally here from Hope Assistance Local Tradies. Just before we get started, I'd like to say thanks to Steph at IPC for helping me organise today's interview. We've got some of the community engagement and support workers from IPC Health here talking to us today. We're really excited about this resource that we're putting together, and we hope that it's a big help for the guys living and working in the West to help them access services that they perhaps might need at this difficult time. With me today is Catherine Cotching. Catherine is one of the Wellbeing coordinators at IPC Health. Also, we've got Kevin Scott. Kevin is one of the alcohol and other drugs mental health counsellors. And finally, with us is Ian Ferreter. Ian is one of the community engagement officers, and his special area of expertise is gamblers' help. Now, we've all been through a really tough time over the last 3 months, and it's fair to say that we've all had a gutful of COVID at this point. We'd all agree that it's put a huge amount of additional stress on our lives at different times, not only for us here, but for everybody internationally. And, you know, we've all had our routines interrupted, and at different times we've felt increased emotional impacts of feelings like vulnerability, isolation, anxiety, uncertainty, fear, and these things can build up. For guys, it's sometimes really hard for us to talk about how we're feeling emotionally, or to have language around what's going on for us emotionally. And with these additional stresses, blokes might find themselves really struggling at this time. Today's an opportunity for us as blokes to find out about some of the resources that are available for us in the area where we're working and living, and hopefully get our mates or ourselves to supports that we might be needing at this time. So my first question is for you, Catherine. I was talking before about how we've all had to deal with those feelings of extended isolation during COVID-19. Can you tell us a bit about the work that you do at IPC Health and how you might help somebody who perhaps isn't sure how to connect with health services or is feeling isolation at the moment?
Yeah, so what I do is I look at the things that affect a person's health that they wouldn't normally go to a GP for. So the things that, you know, it's not about their physical health, it's more about their emotional and social health. So I look at all the things that really impact that. And that could be, you know, their relationship issues, it could be financial, it could be housing, it could be legal, or it could just be that they don't have those social connections and they are looking to connect with their community in some way to enhance their well-being.
Yeah, right, fantastic. And how could, say, a bloke benefit from this kind of service?
Well, first of all, I guess he'd meet with me or one of my colleagues who do the same role, and we'd have a very pretty informal discussion about what the issues were and try to identify any needs that he has. And then I would try to link him into those community support services based on what he's wanting to get out of it. Yeah.
Yeah, great. Yeah. Well, as I was saying before, you know, as guys, we can find it really hard to talk about our feelings and what's going on for us. You know, we often don't have great language around it, and that's not our fault. You know, it's just the way we've been raised, and as blokes, you know, we're trying to get better at this. We're learning all the time to develop tools to support our mates, you know, when they are struggling. My next question is for you, Kevin. Kevin, can you tell us a little bit about some of the counselling services that are available at IPC?
Thanks very much, Tom. Off the bat, what I wanted just to mention, with the COVID-19, the whole world is anxious. So it's not surprising that everybody else is going to pick up on some of that. So it's going to filter down through yourselves, your friends, family, all that sort of stuff. So anxiety is going to be on the increase. So it's how we manage that. Now, IPC Health, they offer a generalist counselling program. So guys and family can contact the intake number and get access to generalist counselling to deal with, you know, all sorts of issues. We also have a stream which is the alcohol and other drugs program, and it's saying the intake numbers, I believe, will be shown at the end of this this little chat. So they can also access the alcohol and other drug program. So it's free, confidential, ongoing support. Some of it is a little bit time limited, but it's support for guys if they want to ring up. The other part of it is the Gamblers Help, and Ian will talk a little bit about that as we go through. But there's help across the board, and it can be transferring between those services. So if the guys have present with one particular issue and they decided, okay, gambling comes up as another issue, they can get help along the way. And then there's my role, which is a dual diagnosis role. So alcohol, other drugs, and mental health issues.
Yeah, right. Yeah, fantastic. You know, as I said, you know, with all the pressures of the last 3 months, blokes have probably, you know, been having a few extra beers, you know, because stuff is getting on top of them and they're feeling like it's a bit much. If someone is struggling with their drinking, they're worried about the fact that they're not able to control how much they're drinking, or perhaps if they're using other things, other substances to change the way that they're feeling at the moment. I guess what I'd like to know is what could a bloke expect if he was going to access the alcohol and other drug support services at IPC?
It's a free and confidential service. At the moment, it's all telephone counselling. So it'll be a phone conversation, and basically it's really a chat to build some rapport and try and engage with the guys and try and find out what it is that they want to do. If they want to reduce their drug and alcohol use, that's fine. If they want to stop it, there's other options. So, and invariably there's other issues, as you say, that underpin it. So, yeah, ongoing counselling support for guys.
And, you know, these things, they don't just exist in a vacuum, do they? I mean, you know, perhaps we're struggling with issues around feeling isolated. We've got anxiety and depression going on, and as a result, we're drinking too much, or perhaps we're fighting with our partner or loved one. And, you know, you mentioned before dual diagnosis. Can you just explain to the people watching today what the dual, what that is?
Thanks, Tom. Nearly all of our clients will present with either some form of anxiety, some form of depression, and it could be that there's a whole series of events along the way that have impacted on their lives. And sometimes it's the last thing, the last straw, that, you know, a cat dies, and that might be the difference of, you know, feeling completely isolated and alone and just struggling. And as you mentioned earlier, often the guys don't have language to talk these things through. So often it can be their workmates who might say, "Look, I'm worried about you," and that ball can get started. So the opportunity for the guys to contact our numbers and basically reach out, because, you know, the important thing is that they're not alone, even though they've been told that along the way.
Yeah, exactly. And I mean, that's the heart of what HALT does. I know, you know, we go out and we talk to blokes and we give them some tools so that they can have that tough conversation with their mate, you know, and say, "Look, I love you, mate. I'm worried about you. I've noticed you haven't been doing too well. Let's get you to the support services that you need so you can get back up on your feet." I mean, you know, we all struggle at different times, and it's about how we get through that, and we help our mates get through it, you know. Over time, we get better at it, and we can get back up on our feet, or get our mate back up and feeling well again, you know, quicker next time. You know, that's what the tough conversations are all about with HALT. So now I'd just like to throw a question across to Ian and introduce Ian. Ian, you're one of the community engagement officers at IPC Health, and your focus is Gamblers Help. I know with pokies venues shut, blokes perhaps are looking at other ways to have a punt, and I've heard that there's been an increase in the use of online gaming apps for that. Obviously, using something like that, you're isolated. You're in your room. No one's sort of watching you do it. And could you perhaps tell us a little bit about how people might be impacted by that at the moment?
Again, one of the things that has been reported in the press very widely is that there's been a surge in online gambling, and so a lot of guys have replaced maybe going to the pokies or going to the TAB or going out with their mates to have a bet and a punt. They've been doing it at home alone. So there's really been nobody there to look out for them, because often when people are at home, they do it alone in a room away from other people. So even the people in the household might not realise how much punting they're doing, and so that's been a key issue where it's made it very difficult for people to then realise what's actually going on and not knowing how they can cope with that.
So, Ian, if I'm thinking, hang on, perhaps this is getting a bit out of hand. Perhaps I'm spending more time, gambling than I feel comfortable with, or I don't want people to know that I've blown a lot of money. If that's happening for one of the blokes out there, how can IPC help somebody who is worried about their gambling, or perhaps is concerned that their mate might have a bit of a problem with gambling?
Well, there are two things. We have counsellors similar to the sort of work that Kevin does, and then we have financial counsellors who can help people get their finances back in control. So often when people have gambled too much, they find that the rent is getting into arrears, maybe the payments on their ute or their truck, that the mortgage is getting behind. There's not enough money for kids' uniforms now they're going back to school. All these are signs that you're spending too much on gambling. So our financial counsellors can assist people in getting their debts in order, so that you don't have the debt collector ringing you every day. You're getting these private numbers. You don't know who's going to be on the other end of the line. So if you've got problems with your finances, having a chat to a financial counsellor, which of course is free and confidential, having a chat to a financial counsellor can help get yourself back into a place where you can deal with your finances and relieve those feelings of significant pressure.
Thanks, Ian. I just want to go back over to Catherine now. Catherine, at the start of the interview, we had a chat and you spoke about your role as Wellbeing coordinator. I just want to talk about that a bit more. And say I'm accessing a counselling service through IPC to help me deal with some of the stuff that I'm going on with. And say, my back's playing up, or my feet are sore because, I've just, been on a building site too long and I'm in some pain or whatever. Can I work with you so that I don't have to, go through all these different phone numbers and those sorts of things to access those services? Can you help out with that sort of stuff?
Yes, absolutely. I mean, as part of my initial chat with your the fellas, I would look at all aspects, not just perhaps one need, but maybe if there's other issues, we can definitely link them into other services at IPC Health, which we have many many of, but also if we didn't have that service, then I would be looking outside of IPC Health to find a suitable service for them.
Okay, so you're saying you can work with guys inside IPC structure to access their services, but you've actually got capacity to work with guys, you know, who are perhaps feeling isolated from their community and stuff to get in touch with services outside of IPC. Is that right?
Yeah, absolutely. I mean, at the moment, we'd be probably looking at online and telephone type of connecting. But I think into the future, we're going to see the re-establishment of a lot of social groups, activities, and we can certainly link them into those depending on what their interests are, but also some additional support services. I mean, I guess a good example is perhaps a chap that I saw who'd separated from his partner. He just wanted to connect with other men who were in that situation. So I was able to link him into a community group where he could meet some people that were experiencing something like he was.
Yeah, absolutely. I mean, that can't be overstated, you know, how much everybody benefits from those feelings of connection, of being part of a community, you know, whether that's your footy team, whether that's the blokes that you work with, you know, somewhere where you don't feel like you're being judged and you've got a sympathetic ear, you know, when you need it. That's just huge for blokes. So, yeah, that's fantastic. Look, I think Steph's going to have a chat about all of the locations that IPC has in the West in a little bit. But, and just at this point, I just want to thank you again, guys, for taking the time to talk with us about the work that you guys do there at IPC. But just at the end, I just want to open it up to everybody, if I could. So, guys, you know, what if I'm worried about me? What if I think maybe I'm not doing so well handling things? What sort of signs can I look out for? You know, what tools can I use to check in with myself? You know, to make sure that I'm traveling okay.
I guess at the outset, I'd be looking at your relationships and, you know, how comfortable you are with those relationships, how much connection you have, whether you enjoy, you know, being with other people. I guess if you're deliberately self-isolating, then that's something to be concerned about. If you're withdrawing from other people.
Yeah, right. And what about you guys, Kevin or Ian? Any advice?
Pretty much the self-isolation is the biggest trigger. So if you notice yourself withdrawing and spending more time either on the punt or alcohol and drugs or whatever it is, than you're used to, then you know, maybe that's a flag should start to be raised at that stage.
Yeah, great.
If you notice you're feeling more angry, you know, you're angry at your partner or the kids or whatever, you know, that maybe that's a sign that could be time to reach out as well.
Yeah, thanks.
And I think one of the things that us blokes tend to do is put off and put off and put off until the stuff is really in the fan. The earlier that we start to try and do something about the issue that we've recognised, the more likely we are to be able to nip it in the bud and get it sorted. But putting it off, there's no point in waiting until the bailiff is at the door to start saying, oh, I need some help with my gambling.
Yeah, and so, you know, and say I'm worried about one of my mates, you know, it might be a colleague, it might be someone I play sport with, you know, and, you know, that's what HALT does is we go out and we talk to the blokes about how they can have some tools around having that tough conversation if their mate is struggling. But you know, perhaps I have got someone that I'm working with and, you know, I'm a bit concerned that they're not doing so well. Have you guys got any tips about how I might have that tough conversation with a mate?
I think being upfront, straight up, you know, and guys will often deflect and say, no, I'm fine, I'm okay. But if you just keep asking and be really genuine about it, saying, look, I am really worried about you, you know, if I can't help you, then maybe there's other places who can. I always can come back to I would much rather have this tough conversation than have to go to their funeral. So, you know, be upfront. It takes more guts to back your mates up.
Yeah, absolutely. Yeah, well said, Kev. Look, finally, guys, just for anyone who's watching today, perhaps they are feeling isolated or that they're dealing with some of the topics and things that we've talked about this morning. Any tips or advice just to finish up for those people?
One of the things I'd say about Gamblers Help is that we don't just work with people who are gambling, but we work with people who are affected by somebody else's gambling. So if you've got a partner who's gambling, it might be really important to come and see a financial counsellor so that you can start the process of protecting your assets just in case things go awry. But as well, you can get some counselling for your personal dealing with the emotions that you're going through.
Yeah, thanks, Ian. And anyone else? Catherine, anything you want to say to close?
Just to take that first step, reach out and just know that you won't be judged. You can be reassured that we're all professionals. We all maintain confidentiality and we won't judge you.
Yeah, absolutely. I mean, we talk to the blokes all the time about, you know, what it takes to be a good listener for your mate, you know, that you've got to give them the space and time to tell their story and listen in that non-judgmental sort of way, you know, and that you have to find that safe place to have that chat. It's not something you can just have anywhere. You've got to put the effort in and you know, that's what being a good mate's all about, you know. Anyway, look, guys, I just want to thank you again for taking the time to talk with me today. It's been fantastic to meet you all, and I really look forward to catching up with you all in person, you know, when this is all over for a cuppa or a beer or whatever. I might just throw it over to Steph. Steph, could you perhaps tell us a little bit about some of the locations that IPC has in the West and let the blokes know about the numbers that they can use that we talked about here today so that they can access some of the services?
Thanks, Tom. And thanks for today and for all your support while we've been working together. Working with HALT has been an incredible experience for IPC Health. To us, it's imperative men get easy access to affordable services. It's also valuable to the community, the work that HALT does. Having those tough conversations with men, it's so important. So thanks to HALT for everything that you guys do. Just wanted to close today to let people know what IPC Health do. So essentially, we exist so that Melbourne's West is healthy and well. So anyone that lives, works or studies in the areas of Brimbank, Wyndham or Hobson's Bay City Councils has access to the many different services, some of which we've touched on today, under the one organisation. You can get in touch with us by calling one of our campuses or visiting our website or Facebook page. We've got our campuses at Deer Park, St Albans, Altona Meadows, Hoppers Crossing and Wyndham Vale. There'll be a screen at the end of this interview that will have all the details on it and links for you to access any service that you require.
Fantastic. All right. Well, thanks very much, guys. Again, Stephanie, Catherine, Kevin, Ian, thanks for taking the time to talk with us today and letting us know about the ways that IPC is out there to support those guys living and working in the West. IPC have fantastic services and guys, I really encourage you to get out there and access them, you know, and get your mates to those supports that they need. Hope everyone stays safe and well. Thanks for taking the time to watch today and we'll catch up with you really soon. Okay, all the best. See ya.
Thank you. Thanks.
Thank you.
guys. Bye-bye.
Bye.
Goodbye.